My name is Mike Crabb. I'm the general manager here at the Woodstock Chamber of Commerce. Part of our goal is to connect people, to provide, accessible education opportunities, which brings us to today with our Learn With Us series. So monthly, we've been hosting calls, which is a great opportunity to put our members on a platform to be able to share their messaging. And this month, we're excited to have Rebecca Lindsay, who is a public education coordinator for Alzheimer Society Southwest Partners. Alzheimer Society Southwest Partners is dedicated to supporting people living with dementia, their care partners, and the communities around them. Through education, advocacy, and community-based programs, they work to increase awareness, reduce stigma, and promote inclusion for those affected by dementia. Their team provides trusted information, education sessions, and support services that empower individuals and organizations to create safer, more welcoming environments and to better understand the lived experience of dementia. If you have any questions throughout, please drop it in the chat. We'd be happy to answer those questions for you. As well, I will be sending information on Rebecca's contact information out if you have any questions at all that you want to maybe take offline. We'd be happy to make sure you get the answers you are looking for. Good morning, Rebecca.
Thank you, Mike, for that great introduction. Nice to see a few folks out this morning and hopefully a few more joining us soon. I'll share my screen here today, but if you have questions throughout, feel free to drop it in the chat or we'll pause throughout for questions and I'll get started. Alrighty, so today we're going to talk about ways we can create more dementia-friendly community spaces within our local community. And the reason why we want to do this is we want to help individuals living with dementia live more safely in their communities and feel welcomed, included, and supported. So a dementia-friendly community looks to support the social needs and physical needs of persons living with dementia and their care partners. So this can be any local business, organization, or facility. They can take this training with us and learn more how to support individuals living with dementia in their community. So I always like to start with some statistics just to kind of ground us in why this information is so important for our local communities to be aware of. Persons living with dementia in Canada is increasing, as you can see here, as there's about over 400 people across Canada a day either diagnosed with dementia or receiving support. And this is due to our aging population. So we're seeing more individuals in that senior population who are experiencing various symptoms of dementia, and the more we can as a community provide support, the better off we are to support people to live at home as long as possible as well. Alrighty. So what is dementia exactly? Dementia itself is a broad term that describes a set of symptoms that many diseases share that typically affect how the brain communicates and works. So on the screen here, you can see that there are many common types of dementia we might see in the community. Often most people think about Alzheimer's disease. This is the most common, and it typically starts in the area of the brain where we make and create short-term memories. So you may see a family member or a client who comes in who is experiencing short-term memory loss and maybe asking repetitive questions or needs extra time to respond or access services, and this would be typical of Alzheimer's disease. Some others we may see in the community are vascular dementia. So this could occur if someone's had a stroke and they're experiencing cognitive changes that are more than what we would see after a stroke. So it could impact their language skills, their ability to communicate, and their ability to maybe reason compared to before the stroke. Some others you may not be as familiar with, but also good to be aware of, are Lewy body dementia. So this type primarily affects people's motor skills. So you might see similar symptoms to Parkinson's, like tremors or a stooped posture, but then they also have difficulty with their memory as well, and maybe some language skills. And the last type is frontotemporal, and this is often more personality changes that are drastic, or it could also be changes in someone's impulsivity or reasoning. So this would be more drastic from what we would see before diagnosis. So I also like to remind people that there are many other causes of memory changes. So we always encourage people to reach out to a family physician if they're concerned about their memory, because some other causes could be things like mental health related changes, medication side effects. If someone's vision or hearing is changing, they may be less likely to engage in conversations or be able to fully process information. So managing that would be something we would want to encourage people to do. A few others are if someone's deficient in certain vitamins or nutrients, they could have increased confusion as well. If somebody has an infection or becomes delirious, also they could be experiencing sudden onset of memory changes or disorientation. So this was something that would be more of a medical emergency as well. And then the last few are even things like sleep disorders. We know if we don't get the proper amount of sleep, how that can affect our mood and behavior, or other things like substance misuse over time can affect our cognition as well. Um, so just things to be aware of, and if someone's concerned about their memory or someone else's, we encourage them to reach out to a family physician for further conversation and testing as well. I'd just like to pause here if anybody has any questions or any comments about anything we discussed thus far before I kind of talk about some of the warning signs of dementia.
I just didn't even you don't realize that there's as many types of dementia there are. Alzheimer's dementia is certainly the one that people I feel are most aware of, but it's interesting to see other ways that it find its way.
Yeah, thanks, Mike, for that. And just recognizing that each person's experience is different and that it can present in different ways is really important for us to recognize as we look at who we're supporting in the community. Alrighty. I would like to now kind of focus on some of the what we call warning signs for dementia. So these would be signs that you may recognize in clients or people coming into your local business, just to be aware that these are some things someone might experience who's living with dementia and how we can better support them. So there's 10 kind of warning signs I'll go through and provide a couple just brief examples of what you might see and how we can support it. So I mentioned that memory is often an early tell sign that somebody's experiencing dementia. And so, for example, if they were in your local business, they may come in and maybe forget why they came in, or they may um, lose track of conversation over time due to how the brain is processing information. So, just encouraging people to have that increased patience and ask how you can support someone if they're maybe confused what they're looking for within your business, or maybe they lose track of the steps that you explained on how to do something. So that's just one example there. I also mentioned earlier that dementia can affect people's mood and personality and behavior. So maybe somebody comes to a restaurant and they're enjoying time with family, but then for no reason they start maybe yelling at a staff member or getting frustrated. Um, Not just due to maybe the noise level, but maybe just they're frustrated by not being able to read the menu, or there's usually something that triggers that in the brain. So as staff members, just being aware that someone may become more easily frustrated or overwhelmed due to those changes in the brain, and just having that increased understanding and patience. Some people with dementia will also have more challenges with language skills. So it can be something as simple as comprehension of complex conversations is challenging. So trying to use shorter sentences or one message at a time can be helpful versus asking them to multitask and do two or three things at once. So I think about if someone was visiting the bank, for example, just giving them one step at a time versus asking them to do three things like signing their name and inputting their bank information. And this can also be paired with things like abstract concepts such as metaphors, or even things like symbols and pictures can be confusing for someone with dementia. So, for example, going back to that banking example I just shared, they maybe remember their PIN number, but maybe have a harder time recognizing on the ATM what buttons to press in what order. Um, or even something as simple as reading signage might be confusing if there's too many words on a sign as well. Some people may also have more difficulty doing certain tasks over time they've always done. So things like maybe making a cup of coffee becomes a bit more challenging because their brain mixes up the order of steps. So for example, if someone was coming to your business and they were asking to order something, they might forget the order of steps on how to do that, and you may need to break down it into smaller steps for them and take some more time to help them with completing those tasks. Another warning sign that we don't often think about, and people ask me all the time about this one, is misplacing things. And so this isn't just us normally misplacing things when we're busy running around uh, with lots on our mind. This is when somebody misplaces things and puts them in places that don't make sense, and then has no recollection of where they've put it. And this happens frequently. So putting things like their car keys in the dryer or their oven or somewhere where they think is safe, but then they don't remember. So just being aware that somebody may be more likely to maybe even leave something, say if they're at a restaurant, leave it in the booth and then forget where it is, and it could increase their frustration as well. The next warning sign that we sometimes see is that some people with dementia need a bit more encouragement to start tasks, or they maybe start a task but then get lost in a task and are not able to move on to the next step. So for example, if they were visiting a store or the grocery store, they may be standing still in an aisle for a long period of time and not able to maybe get the next thing on their list or know where to go to get to the checkout, unless somebody came up and maybe offered assistance or asked if they needed help finding something. So just needing more motivation due to the brain not triggering that kind of start button. We have a couple more here. So this is a big one I'm going to talk about today, is becoming disorientated, and losing track of time, or even becoming lost in familiar spaces. This can happen at any point in the disease process, but more in the later stages of dementia. We see people, maybe they've always walked around their neighborhood and now they're losing track of time of how long they've been out for a walk, or maybe they walk to the grocery store or to Tim Hortons every day, and they, due to how their brain is changing, they might get lost on the way back. Um, and so we'll talk about some resources on how we can prevent people from going missing and support their safety in the community as well. There's just two more here I just want to briefly touch on. One thing people don't maybe know or think about is that dementia actually can affect people's perception and how they see information in the world. So you can see in this image how the railing there looks kind of wavy with the shadows. And so we think about someone with dementia might misperceive where the steps are because of how the brain is seeing. They're actually seeing the information, but it's misperceived or kind of altered. So just keeping that in mind. When looking at your environment, are there things that could be misperceived, or could be maybe like a fall or tripping hazard as well? And then the last one here is impaired judgment. And the reason I bring this up is because some people with dementia, it can affect their ability to assess risk. So over time, they may not notice if they did get lost, that there's a risk, or maybe they might make decisions that aren't what we would typically see. So I have on here riskier financial decisions because maybe they're not aware of how much money they're spending. And so these are other topics we talk about at the society, is how we support someone's independence and balance that risk as well. So before I talk a bit more about some of the risks and how we can support that, I'm just going to pause because I think there might be a couple questions here in the chat.
We had some good mornings from some folks in the chat,
Oh,
but I do have a question if you don't
yeah,
mind, and I apologize if I'm getting ahead.
that's okay.
I'm going off a personal experience of mine. Um, uh, I used to be the general manager of our community theater. I got a call from a patron who had lost her wallet. I went up, I had a look, didn't find it. So I had let her know. She said thank you and hung up. And then a few moments later had called back and continued to call back a few times. And then I realized, she might be having a moment of dementia. And I didn't know how to assist her. Um, and so I'm sorry if maybe we're getting to it still, but I'm really curious of how I could navigate a conversation like that where I can assist her without throwing her off or um, embarrassing her or anything like that. Do you have any recommendations of how I could have navigated a conversation like that?
Sure, and that's a great question, Mike, because often those are difficult situations to know how best to support her dignity and independence, but also not confuse her further. And so I can give a few examples now, and we'll touch on a few more later. But I think in the moment, the biggest thing I always encourage people to do is first off validating her emotion that that's frustrating. Um, and you did a great job of looking for her wallet and making sure she knew that you had looked for that. Um, and then over the phone, if she had called back a few times, I think just in the moment, reassuring her, or asking if she was able to look at home to see if it was there, and that we would keep looking for it and let other people know that we were there to help. And then I think we'll talk about some ways to kind of not redirect conversation, but kind of direct it to another conversation. So we're not continuing to, I guess, dwell on the the issue that she was having. But I think, yeah, validating her emotions and then letting her know that you are on top of it and you'll look into it. And then we'll talk about some ways to kind of redirect to other conversation as well.
Okay, thank you.
You're welcome. Alrighty, so I'm just going to briefly touch on just a few resources that we might want to be aware of just to share with family members or also just to have awareness of what's available in our community. Because I did mention that for some people living with dementia, there is a risk of going missing due to the fact that the brain does change and there's some changes in awareness level or impairment that can happen. And so there's a provincial program that we promote. It's called Finding Your Way Ontario, and I'll send out a link after our session just for more information. But it has great modules and videos and resources for families to access so they can try and put things in place to be proactive, to try and reduce the risk of people going missing and support people living with dementia safely in the community. On the next slide, I'm going to show a couple statistics about the risk of going missing and some resources we can put in place to help people return safely back home if they are at risk. And this is more just for our awareness. As the more people we have in the community who are aware of what it's like to live with dementia, if we see something that's kind of out of the normal, then we can help support people to get back home safely. So across Canada, they say about 4 in 10 people can go missing at some point. And when we say going missing, it's that they're not where we expect them to be. So maybe I expected my grandparents to come meet me at a restaurant and they're not there. And so they do say that some people living with dementia can wander. And if they do, they could potentially be missing for up to 5 hours and 9 kilometers away from home. And we think about our winter weather right now and how scary that would be if someone did go missing. And often it's that they're walking towards something that is going to meet a need of theirs. So maybe they just went out to go to the grocery store but get lost along the way, or they're walking to Tim Hortons to meet up with friends. So if we suspect that someone's missing who's living with dementia, we want to contact first responders to help ensure they get back home safely. And so how would you know if someone's living with dementia? We don't know exactly, but some warning signs you might see is maybe somebody's standing on the street corner in maybe a bathrobe or inappropriately dressed for the weather. Maybe they don't have a coat on. They might be pacing back and forth at an intersection, not knowing which way to go, and maybe repeating some questions. They could be asking, do you know where my house is? Or can you help me find the grocery store, for example? So it's things that related back to those warning signs we talked about earlier. And so if you do find someone who's seems confused and maybe showing some of these signs of dementia, some other things you can look for are some people might have an ID card on them. And this is an example from our local society that some of our clients carry on them. And it's also a good resource for business owners to be aware of because somebody may show this to you in your business, and it indicates that they need maybe some extra patience and assistance as well. And it helps reduce stigma and make it more of a normal part of conversation. Another thing that we also have are medical alert bracelets with the blue emblem. So this signifies somebody has cognitive changes and it can be connected with the local police department. So if somebody did go missing, it would have their contact information and it would help first responders find the individual quicker and also connect them back with their family in a more quick fashion and in a safe fashion. And this last one here, we don't have in Oxford County, but in Elgin County, they have, it's called Project Lifesaver. And it's a radio frequency watch that the person living with dementia can wear. And it helps if someone does go missing, the police department can help locate them with this tracking device. And two other resources just to be aware of for family members as well is that our local paramedics have medical information forms that people can fill out to have on their refrigerator. So if you need medical assistance, all your information is right there. And also on the Finding Your Way website, they have what's called an ID kit. And so this is kind of like a vulnerable persons registry that the police department has, but it's specifically for people with dementia. And it provides all their information in one kind of one-pager package. So if they do go missing, this is something you could give to first responders that highlights maybe frequent places they go, things that are important to them, and has all their medical information. So it's just a great way for families to be proactive in case there is an emergency as well. I'm just going to pause for a second. Any questions about the Finding Your Way resources or any other information? Okay, I'm going to keep going. I think this is the most important part that everybody probably is interested in is how can we communicate or provide better interactions with people living with dementia. And so this is important because um, if we're better able to communicate and offer that patience, then we're able to have people more active in our communities. And that's the goal. We want people to be able to remain active in their communities and be involved and not feel like they can't go out to maybe their favorite restaurant or their local business because of communication difficulties. Excuse me. So, um, some things you can do that are beneficial not only for people living with dementia, but for everyone, is approaching from the front. So we want to think about if somebody came up behind you to start talking to you, you might be more startled. Same goes for someone living with dementia, especially if they can't see you coming. So always approaching someone from the front and introducing yourself as if it's the first time you're meeting them. Because some people with dementia may recognize you but not know maybe your name or who you are. And over time that can change as well. I always encourage people to also ask if you can help someone and not assume that they need help because often what happens is people will talk to their family member or a care partner versus the person themselves. So always including them in conversation and offering simpler choices. So keeping conversation very simple and providing very clear instructions. So for example, yes or no type questions, or just offering one choice at a time versus saying, here's all the information, and then expecting them to try and pick out the key points. Some other ways you can enhance your communication skills are reducing distractions. So often it can be overwhelming for someone with dementia to be in a large crowd as it's hard for them to filter out background noise. So reducing distractions or even taking them into a quieter space can be helpful. And making sure we have proper eye contact and ensure that they're allowed enough time to understand the conversation. Um, So, for example, if we were in a large room, I might take the person aside and take some extra time to explain instructions versus maybe talking in a larger crowd. Some other things you can do is use shorter sentences. And we say it takes people about 10 seconds to process information. So allowing them about 10 seconds to process what you just said before asking another question. And finally, another thing you can do is just speaking a lot slower and more clear. So often, especially if somebody also has a hearing impairment, we want to talk in a slower tone versus like a loud, more aggressive tone. Just something quiet and soft and reassuring can be helpful as well. And then going back to Mike's question from earlier about maybe somebody having a reality that's different from ours, or maybe they lost something and they can't remember that they misplaced it. Often we want to recognize that even if we do reassure them and say, oh, we're looking for your wallet, or that's very frustrating that you lost it, they may still come back to that reality a few times until the like underlying emotion is supported. So first, we want to always offer reassurance and connect with them. So we don't want to correct them and say, oh, well, we don't have your wallet and you probably left it at home, or we would never do that. We would want to connect and say, that's very upsetting. I would be upset too if I lost my wallet, and we'll continue to look for it for you. And um, if we find it, we'll let you know. Some ways you could continue to kind of redirect the conversation is maybe asking them about how they enjoyed the show that they came to see at the theater, and maybe asking, is there somebody else who's coming to visit that could maybe help you look at your place as well, and just kind of shifting the conversation from what they're frustrated about and validating that emotion and then redirecting to another conversation may help kind of put them at ease and validate that underlying emotion. And the last thing is always just observing people's body language. Often that says a lot about what they're experiencing or if they're understanding what we're saying. So if somebody seems a bit confused or maybe didn't fully understand our instructions, maybe asking, would you like me to repeat that? Or is there some other way I can explain it? Just to ensure that they feel validated and included in conversation. Does anybody have any examples that they'd like to ask questions about, or any questions about communication? We'll just go back here.
Rebecca,
Yeah.
I've had a customer who has dementia that would book an appointment with me to come and do work, and then we would come and they would have forgotten that they had booked the appointment.
Yeah.
So, um, de-escalating that like sudden change in their routine for them when we showed up was a bit challenging. Um, so we were just trying to maybe gain some skills if that happens again on how we could, because from our perspective, it's very challenging for us to reschedule our day, um,
Yes.
um, to fill our day, but we want to not upset our customer either. So, what would you suggest? I had thought maybe I could have given them a reminder call the evening before their appointment. Um, uh, that was my only real thought at the time. Yeah.
Yeah, no, that's a great question, Nicole.
Mhm.
I would say definitely any way you can send reminders, whether it's the morning of or the night before. Um, providing, when you did show up at the house, providing maybe a reminder card or something they could put on their fridge could be helpful. But I think to answer your question about de-escalation, I think often validating their experience in the moment, even though that's difficult for you all to have to reschedule and fill your day, often validating their emotion that they did forget, and that's okay, and we don't want to make them feel bad. And then if there's any way that you could either do part of your work or part of your visit at that time, or then asking them, is there another time I could come back next week or whenever works for your schedule. But again, also recognizing your time as well, because it's hard to reschedule appointments. So I think just the biggest thing for de-escalation is just validating their emotions in the moment and saying, it's okay. We'll figure out something to make sure we can still do the work for you, and kind of just validating them that it's okay, that they forgot their appointment, and kind of working through that together. I know it's not an easy, like one size fits all for sure, and depending on if they were actually there at the house or if they remembered you were even coming as well. Kind of changes your response.
Thank you.
Yeah, you're welcome. Any other questions about communication or examples you want to ask about?
I would love to ask a question in regards to the patron at the theater who lost her wallet. Now, in
Yes.
through the discussion, if I found that maybe she had come to see the show with, say, her daughter, and in our database was able to find a contact number or something for her daughter, is it appropriate to call and say, hi, your mom's called and she's inquired about her wallet, and I'm worried that maybe she's confused? Is that appropriate, or is that, I feel like it might be overstepping, but I also worry for that patron that's confused.
That's a great question, Mike, and I think it's all about how you would word that conversation. I think that if you were concerned about a patron, similarly, if you were concerned about maybe their physical health, for example, or if they had fallen, for example, you would follow up. But I would say in that moment, you could just, if you had the daughter's contact information, you could always call to just say, this is the situation that happened, and maybe just say to her, if you're able to connect with your mom, she was really worried about the wallet, and maybe more focus on that piece of it versus the memory side of things. And you could say what happened. She's called a few times and seemed really worried. And then if the daughter had mentioned anything about memory, you could always offer to connect to our services, or just offer resources if that's something the daughter would be open to. But I think just keeping it more general of, I'm a bit concerned she's called a few times, and are you able to follow up, would be a good kind of first step as well.
Okay, that's good to know. Thank you.
You're welcome. And it's so challenging too, because we don't want to feel like we're overstepping or like forcing information on people. But I think just the way you worded it would be a great kind of first step.
Of course. Thank you.
Yeah, you're welcome. Um, just to finish off today, I have a couple more slides here that we would talk about in more depth with local businesses if we were doing more one-on-one training or conversations. But just something to be aware of is another way you can enhance your space to make it more dementia friendly is looking at the space itself and how it can be accessible and inclusive. And these are things that are kind of in addition to what your normal accessibility standards would be. So on this picture here, you can see things like there's big color contrast. And so I mentioned how dementia can affect people's visual and spatial awareness. So things like yellow or blue can be easier to see over time. And having signage that's very bold and that's at key decision points like by doorways and hallways. And having both words and pictures on signage can be helpful, as some people with dementia may understand one or the other. So if there's a picture of a toilet, for example, and the word washroom, that would be a good indication for someone to know where that is. So this is something we would talk about more in depth with businesses, but just a concept I like to highlight and introduce if you want more information about that as well. Finally, I just always like to ask people if there's anything from today's presentation that stood out to you or something that you think you could do within your organization that could help make your space more dementia friendly. So if anybody wants to unmute and share something or in the chat, I always like to hear what people's kind of takeaways are from how we can be more dementia friendly.
I'll begin. I just think the awareness of it that you've shared today, I think, is really vital in just opening our perception to not knowing any interaction we're ever going into with any of our customers, clients, patrons. And so when we, might have an experience with somebody who has dementia, it can be quite jarring to compared to a typical conversation. So to know to catch those signs earlier in a conversation or an interaction, I think is really quite vital for ensuring that the conversation goes productively or support that person. And I think kind of the underlying theme of what's the word I'm looking for? Excuse me. Making sure that they have, oh no, I've forgotten the word. You don't want to take away their sense of
Like independence or dignity or
dignity is the word I was looking for. Thank you.
You're welcome.
That's such a delicate thing for anyone, right? So I think, having this perspective as we approach conversations and knowing how delicate things like dignity can be, and how important they are to everyone. It's really you've given us some perspective on how to navigate these conversations well, making sure that is forefront of the conversation to make sure that that person is understanding what they need to understand, and that you're supporting them in the way that you're capable of, and things like pacing, just slow the conversation down, because I could imagine some people might feel frustrated and the conversation then picks up because you're not understanding what I'm saying, and then in turn could snowball things a little bit, right? So in terms of here at the chamber, what we could do is, maintain that open mindset, that knowing that we're dealing with all walks of life, and patience goes a long way for everyone. So I think that this is really good. And to know that there are resources out there to help support me or to maybe pass along to folks that might be needing some assistance, that the Alzheimer Society Southwest Partners has things that we need to get through these things comfortably and supportively.
Yeah, thanks for that, Mike. And I can definitely share some more resources with people afterwards as a starting point. And I'll talk a bit more about what education we have for businesses as well, if that's of interest to people. But definitely, the more we can support the dignity and independence of people living in the community, this community approach is so important for everyone we're supporting, and just being aware of how we can better support those conversations and support the dignity of individuals like you mentioned.
Andrea had just put a comment in in the chat here. I want to say first, thank you for this information. It is all great to keep in mind. Second, my business does not have a physical space. I work with people in their home, community spaces, etc. Are there resources or suggestions for navigating supports and spaces that I have no control over?
Yeah, that's a great question. Thanks, Andrea, for sharing. I definitely can share some resources with Mike after to send out in an email about physical spaces. And there's some information too about ways to navigate conversations with community spaces you're renting from, or just having conversations about how we can set up the space. So, for example, if you're in a building that's very large and confusing and has lots of hallways, maybe during your spaces, you could have someone walk people from reception down to the program space, for example, if you had a volunteer or a staff member, um, because we recognize that there's not always room to make major changes in spaces that are not our own space, but there are definitely little things like that, or asking a business, is it okay if we put up some extra signage to help people find their way to the program space, for example? So I'll definitely send some resources out on ways you can kind of make those cost-effective and easy changes that don't require these giant renovations of spaces.
It's a great idea.
Yeah, and I do have some brochures as well on how to make home spaces more dementia friendly as well. If that's a resource family members might be interested in as well, I can share that.
Excellent, because that actually answers the next question from Janice, who was asking, "Do you help find resources for families?" So I'm sure in regards to business and community spaces, there's a dynamic there of meeting new people and experiencing this what they're going through. But for families that are experiencing loved ones and seeing how they progress over time has got to be challenging on so many other levels, that resources and often people don't know where to turn. So knowing that, Alzheimer Society has the resources that can help, make them feel a little bit more comfortable and supported, would be a really great value.
For sure. And I can definitely, I'll share our website and some resources we have accessible for the general public and some other websites I mentioned throughout this webinar. And I'll just take a few minutes now to kind of go through our programs and service information as well, for how you can further connect with us as well.
Excellent.
Alrighty. Before I do that, I just want to highlight that we have a program called Dementia Friendly Community Supporter. This is for any organization in the community, whether it's a local business, a faith community, senior centers, you name it, any organization who wants to do further training with us, whether it's on communication tips or working with us to create a more dementia-friendly space. And so if this is of interest, it includes education and ongoing mentorship and action planning with our education team. So you can definitely connect with myself afterwards. I'll send my contact information out if you're interested in learning more how your business can become a dementia-friendly community supporter and access more education from us as well. And supporters that we have said that it helps build a stronger, more empathetic space and enhances their policies and procedures, makes their space more accessible, and demonstrates their ability to commit to being inclusive and also cater to our aging population. So if this is of interest to you, I'd be happy to connect further to provide some more information about the education we offer for local businesses as well. And just briefly to touch on our programs and services, because I know Janice asked about support for family. We do offer a circle of support. So we offer clinical services, education for our clients and also healthcare providers and businesses. And we offer some therapeutic recreation programs as well. And these are all for people who become clients of ours and who connect with our intake team. But we also have lots of public resources and education as well, which I can share in a follow-up email. If you are interested in becoming a client or if you have a family member who could benefit from more support from us at the Alzheimer Society, there are a couple different ways you can connect with our intake team. We have our referral form on our website, or you can contact our office here in Woodstock to start that process. And then they'll connect you with our First Link team to do kind of that follow-up conversation and assessment with your family member to provide what services we have and connect you to other community resources as well. And so I'll leave up my contact information here for a few moments, but I'll also share it in the chat. And just want to thank everybody for attending today and learning more about how we can support people in the community with dementia and become more dementia-friendly businesses as well. So if there's any other questions or comments, I'd be open to answering those now as well.
So the chat is open. If anyone wants to unmute, you're welcome to hop on. In the meantime, Rebecca, I'm really grateful for your perspective. I think that this is something everyone needs to know more about. It's one of those things that maybe you haven't had an experience yet, but you want to be prepared when that day does come, whether it's you, whether it's your teammates, your staff. So I challenge everyone on the call that if you have anyone in your life that might benefit from learning about this, please, we're going to send the link out to watch us again, to revisit, as well as contact information to Rebecca and her team. I challenge you to spread the word and help get it out there. Ask questions. It might be, a week later and you think, oh, you know what, that might be something worth asking now, as opposed to when you're in the middle of dealing with something. It's free to ask, right? So never hesitate to reach out and get that perspective while it's fresh in mind. I think that it's a really great way to support our community and those most vulnerable within our communities to help make sure that they have the best experience possible. Thank you very much, Rebecca. You're very well spoken. It's clear that the work you do is what you love to do, and our community is better because of it. So thank you so much for your time. We look forward to continuing seeing you at our Business After Fives. Hey, if you guys want to meet Rebecca, she often comes to our Business After Five, so please join us. And in the meantime, we look forward to seeing you on our next Learn With Us call. I will include that in our next, in the wrap-up communication as well, too, if you're interested in joining us for that. Check out this link. Will be on our YouTube channel, on our resources page of our website, and we'll also be sharing it in our newsletters and social media pages. So everyone, please take a moment to pop a thank you into the chat if you haven't already. Everyone's kind of rolling in there. And we look forward to chatting with you again soon. In the meantime, have a wonderful rest of your week ahead, and we'll see you around. Thanks, folks. Thanks, Rebecca.
Thanks so much, Mike.